Getting pregnant is a good news, especially for women that are trying to conceive. So, as a woman trying to conceive, you did your pregnancy test at home with urine and you found out that the result was positive. Definitely, you will be excited. And the next thing is to, oh, let me go to the hospital and confirm. You do the blood test, and the blood test confirmed that you are pregnant. Definitely, you are going to be excited, elated, and it's going to be a celebration mood for everybody. So you decided to wait for your first scan after 8 weeks, or you decided to wait till 14 weeks before you do your first scan. Just for you to get to the doctor after 8 weeks, after 14 weeks, and the doctor says it's a molar pregnancy. It's a molar pregnancy. And the next thing that comes to your mind is, doctor, will my baby survive? You don't even want to know like what molar pregnancy is. I believe the next thing in your mind is just going to be, will my baby survive? So I had a message from one of my subscribers asking me to talk about molar pregnancy, and I decided to make this video today. Good day everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Mercy Mary, popularly known as the Nurse with a Difference, and I make learning easy and accessible for all my viewers. Today, I'm going to be talking about molar pregnancy, what molar pregnancy is all about. We're going to be talking about the causes, we're going to be talking about the risk factors, the complications, and I'm also going to be sharing with you the symptoms of molar pregnancy. But before we go into details into this class, if you are new on our YouTube channel and these are content you are interested in, please click on that subscribe button, turn on that notification bell so you don't miss out. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Let's go there. All right, welcome back. So the first question is, what is a molar pregnancy? A molar pregnancy is a rare complication of pregnancy. Yes, it occurs when there is an unusual growth of a cell called trophoblast. There is an unusual growth, an abnormal growth of a cell called trophoblast. You may want to ask, what is trophoblast? Trophoblast is what forms parts of the placenta, and trophoblast also helps the embryo, that is that fetus that is developing, to stay properly in the womb. It helps to fit that embryo properly in the uterus. So when there's an abnormal, when there's an unusual growth of this trophoblast, we say that this woman is having a molar pregnancy. There are two types of molar pregnancy. We have the complete molar pregnancy, and we also have the partial molar pregnancy. But first, let's talk about the complete molar pregnancy. In complete molar pregnancy, the placenta tissue swells and appears to form fluid-filled cysts. There is no fetus. In complete molar pregnancy, there is no fetus at all. What you are seeing is a fluid-filled cyst. But while in a partial molar pregnancy, you are having both the regular and irregular tissues. But in the complete, all of them are irregular. But in partial, we are having regular and irregular tissues. So you may see fetus in a partial molar pregnancy. But be it complete or partial molar pregnancy, the child is not there. The fetus cannot survive. The baby cannot stay. All right. So if you've had, like, if they've told you you have a molar pregnancy, I believe the only option from the doctor is to take that product, those product of conception out. Yes, is to take it out because a molar pregnancy cannot survive. Now that takes me to the signs and symptoms of molar pregnancy I want to share with you. In terms of symptoms of molar pregnancy, the fact is a molar pregnancy might seem like a normal pregnancy, especially in the first trimester, the first 3 months of pregnancy. You are not going to know that you have a molar pregnancy. But also some of the symptoms that you're likely going to have is a dark brown to bright red bleeding from the vagina during the first trimester, severe nausea and vomiting, sometimes grape-like yeast that pass from the vagina. They might be having pelvic pressure or pain. So these are the signs that are likely going to show up. But usually, the signs are usually detected in the first trimester because of improved technology over time. But if it doesn't pop up during the first trimester, some of the signs that you're likely going to see as time goes on is the uterus, the womb becoming bigger than expected. For example, you are 3 months and the womb is already looking like you're 6 months, 7 months pregnant. So that can be a sign of like a molar pregnancy. And also this individual might now be having ovarian cyst, hyperthyroidism, ovarian cyst, and also preeclampsia. Preeclampsia, a condition that causes high blood pressure and protein in the urine. Now, let's talk about the cause of molar pregnancy. So, an egg fertilized atypically is the cause of molar pregnancy. Yes, an egg fertilized atypically is a cause of molar pregnancy. Let me explain. You know, when we were in secondary school in biology class, they talked about the chromosomes, that chromosomes from the man and also from the woman, they come together. That is what makes up the baby that is being formed. So each we have 23 pairs of chromosome. 23 pairs of chromosome, that is everything making it 46 pairs. So that 23 pairs mean if this is a pair now, so one from the mother, one from the father, one from the mother, one from the father, one from the mother, and one from, to understand what I mean. So you have 23 pairs of chromosome. So in terms of a complete molar pregnancy, what happens is that when the egg is fertilized, the mother's chromosome is missing. The mother's chromosome is not there. It's just the father's chromosome that has copied itself. So you're not having like two of the father chromosome instead of one mother, one father, one mother, one father. So that is that for a complete molar pregnancy. I'm trying to break it down as much as I can. So why in terms of partial molar pregnancy, what happens is that the mother's chromosome is there, but the father is not supplying two instead of one. Am I making sense now? So these are what is causing that end result of that molar pregnancy that you are seeing. I'm going to go over it again and break it down as much as I can. I said in terms of the cause of molar pregnancy, atypically fertilization of the egg is what is causing that. In the sense that when it comes to chromosome issues, we're supposed to have 23 pairs of chromosomes. And in terms of that 23 pairs, each pair, one is from the mother, one is from the father. In a complete molar pregnancy, the mother's own is missing. So you just have the father's chromosome present. But there's fertilization. Fertilization was done, but the mother's chromosome was missing, is missing, is not there. So the father has to do two. You now have like the father's chromosome has to copy itself. But in partial molar pregnancy, the mother's chromosome is there, but the father donated two instead of one. So it's not something like the couples can control. It's not what they can see and say, okay, I will give one, I will not give one, I will give one, I will not give one. So it's just I would say a genetic thing that takes place during fertilization, after fertilization in the womb. So take note of the fact that is what causes a molar pregnancy, and nobody should be blamed. The man should not be blamed. The woman should not be blamed when it comes to the cause of molar pregnancy. So then that takes me to the risk factors of molar pregnancy. People that are likely going to get molar pregnancy. The first set that are those that have already gotten molar pregnancy. So if you've had history of molar pregnancy before, you've had molar pregnancy before, there is also a chance that you are likely to get molar pregnancy. I'm not saying your next pregnancy is going to be molar, but there is a chance, there's a risk factor that you are likely going to get a molar pregnancy. Then also, if you are advanced, let's use the word advanced, or if you are aged like above 40, above 43, you are at risk of giving birth to a molar you are at risk of having a molar pregnancy, not giving birth, sorry. You're at risk of having a molar pregnancy. So in terms of the prevention of molar pregnancy, the first thing we advise generally is that if you've had history of molar pregnancy, kindly speak with your healthcare provider, your doctor, your nurse, your midwife, before making an attempt to try again getting pregnant. And also, if you've had a previous molar pregnancy, it's advisable you wait 6 months to 1 year before you try again. If you've had previous molar pregnancy, it's very important you wait from 6 months to 1 year to avoid reoccurrence of another molar pregnancy. Then the last thing I have to share with you is the complication of molar pregnancy. The thing is, after removing, you discover it's molar pregnancy and the doctor took it out, there's a possibility that the molar will regrow again. You understand? We start growing, especially if it's cancerous. You know, cancer grows and cancer spread. So there is what we call persistent gestational trophoblastic neoplasm. Yes, GTN. It happens more often in complete molar pregnancy than it does in partial molar pregnancy. So one sign of persistent GTN is a high level of HCG. That is, after taking out this molar pregnancy, you do a pregnancy test, you still see that you are pregnant. It shows that your HCG level is still high. So that is one of the complications of molar pregnancy. So for the individual that asked me about molar pregnancy, I hope I've been able to give you an answer about what molar pregnancy is all about. And if you've had molar pregnancy, that does not mean you can't have a normal pregnancy. So don't get it all wrong. That doesn't mean you can have a normal pregnancy. So what is advisable is for you to stay 6 months and 1 year before you try again to avoid reoccurrence of another molar pregnancy. You may try again and it might not be a molar pregnancy, but it is advisable you stay away for some time, allow your body recover so that they can see if there's any abnormal growth after the removal, so that proper management can go on before you try again. But in all, if you want to try and conceive again after molar pregnancy, kindly speak with your doctor. Okay, and if you've had history of a molar pregnancy, it's important to do the 8 week scan. Once you know you are 8 weeks pregnant, go for a scan. Don't wait till 14 weeks or 20 weeks before you do your first scan. So this is what I have to share with you today in regards to molar pregnancy. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye and see you in our next video.